I personally would consider a clinical trial if I was diagnosed with a cancer or if I had a family member that was diagnosed. It's really one way that the patient can give back to the medical community and other patients that are in their shoes to help us develop better treatments for cancer.
What I often say is that it's an impossible question to answer. And the reason I say that is because you are going to have different values and backgrounds and goals than I might, or that the person down the street might. Okay? I think it's very important that we're not a cookie cutter practice and say everyone who has X diagnosis has to go on X trial. No, we have to make sure that every patient's individual goals, their values, their needs are taken into account. So I think that's how I answer the question. But our kind of national guidelines say that the best treatment for a patient is usually a clinical trial, and I agree with that. I think it's very, very rare for me to say to a patient, here's a clinical trial, but for X, Y, or Z reason, I don't think that's right for you. I certainly do it, but for most patients, it's absolutely worth considering for all the reasons we've talked about already. It provides you, potentially new medications that you can't get anywhere else that can be of benefit. It provides you that kind of safety net where we have a lot of folks watching very closely to make sure that you tolerate the treatment well, and you're helping to advance the science, which, as I said, I think many people find very meaningful. And so for all those reasons, I think if it was my family member, I would say absolutely. If there's a trial, you should consider it. It might not be right, but at least consider it.